Hey guys, Dr. Ben here, going to talk to you today about whatever you want to talk about. We've got all types of questions coming in. Many of you are really just asking about everything going on in their life, and it could be immune system, it could be your thyroid or your gut or sleep or any of these different things. So we're going to spend about the next 30 minutes here just answering questions. I can get specific into some different things. Not going to really give you a whole lot as far as, hey, you need to take this exact amount of supplements. Can't really do that from a distance like this, but you could say, hey, what do you think about this supplement? Should I be doing this? Should I not be doing that? So welcome everybody. Pop down below. One, I want to see where you're watching from. All over the country, all over the world. We've got people like Justin there down in Tennessee. We've got people all the way in Europe and Asia and all over the place. So love seeing you guys, and just pop down below where you're watching from, and then any questions that you have, and we will be going through those. So let me bring up some of these questions here, and we will get started. All right, so let's jump into this. West Virginia, great to have you on there, Susan, and Christy in Cody, Wyoming, and Colleen. What kind of doctor is he? Great question. So I did my undergrad at Syracuse University in exercise physiology. I went to Parker University and got my Doctor of Chiropractic there. And over that time, this was way back when Dr. Jeffrey Bland, he's the godfather of functional medicine, and I started doing a lot of training with him. And from that point on, I knew, because looking back at how my mom healed from MS, how my mom was able to reverse her MS, get out of the wheelchair, get out of off the drugs, all those things. She's now 78 years old, no longer has MS. I thought, man, there's something to this. Why can the body be able to heal like this? And so that's what drove me down this path. My intention all along was to be able to start working with patients one-on-one, helping them on this metabolic side of the fence, and say, hey, how are we going to be able to get the body healing? And so throughout this time, for the last 20 plus years, I've learned from some of the greatest minds in the world. I've been able to work with tens of thousands of patients all over and really make some dramatic changes in life. And so that is a great question. Thank you. Even in our additional offices, we are actually hiring chiropractors for those positions, and not so that they can do adjustments, but because of what's up here. It's the philosophy that makes all the difference in the world when you're talking about functional medicine, because a lot of people can come over from the traditional medical side, say they're doing functional medicine, say they're doing some natural things, but ultimately they're still doing this for that. If you can't sleep, give you melatonin. If you can't digest, give you some type of enzyme. And so the philosophy that I was able to gain in chiropractic college was one of the body can truly heal. And if you give the body the right things, take away the wrong things, the body has that healing potential, that innate intelligence, innate wisdom inside of it that can heal. And that's what we do every single day with people. So thank you. Great question. A lot of people, just wonder what somebody has for their background. Colleen, I mean your guest speaker, and not sure what guest speaker you're talking about. I'm not sure who we have right now, but thank you. And in Phoenix, are you also in Phoenix, Arizona? So currently, if you've noticed, we've taken the Phoenix tag off of our Facebook page. We're in the middle of actually franchising this model, and they are not an official office yet, so we can't have them up there yet. But we have many other offices coming up around the country. We'll be coming to the Denver Metroplex. We're looking at the Lincoln and Omaha area, Nebraska, Kansas City, Springfield, Missouri, Tulsa, Oklahoma, a lot of different places. We're expanding into Nashville. December 1st, we'll be opening up a second office in the Nashville Metroplex up in Mount Juliet, and then in first quarter of 2022, we will be in Knoxville, Tennessee as well. So got a lot of people's lives that we're going to be able to change all over the country. So great questions. And hey, Leanne from Garing, great to see you. Recently diagnosed with fibromyalgia. Vitamin D is low too. What foods should I avoid? So fibromyalgia, unfortunately, fibromyalgia is kind of a catch-all. It's not really a true disease. You know, yes, you can go in and touch these sore spots and go, okay, you've got fibromyalgia, but what is it? You know, is it a bacteria? Is it a virus? Is it a thyroid thing or adrenal thing or whatever? It's no one thing. And so fibromyalgia, kind of a catch-all, kind of a cop-out of a diagnosis, in my opinion, because really we've got to take a step back and get to that underlying why. I was just working with a lady early this week, and she's down 27 pounds at her 3-month follow-up, and she said, I no longer have fibromyalgia pain. What did we do? Did we do the fibromyalgia protocol? No, that's not what we did. We went through and fixed her blood sugar, fixed her gut, fixed her liver, fixed her inflammatory system, fixed the infection, whatever was going on, that is what we worked on. So the foods that you should avoid are the foods that are going to make your blood sugar spike up or crash down, the foods that are going to create inflammation where, you know, oh, my ring doesn't fit, the foods that are going to make you gain 3 pounds overnight, and the foods that are going to stimulate an immune inflammatory cascade. So that is what you need to do. If your vitamin D is low, you've got to take some vitamin D. Also consider tanning bed, even once a week, can be very helpful for that vitamin D. Thanks for watching, Leanne. And let's see who else we have here. Any other questions? There's Angelique, suggestions for LDLs. I'm assuming that that's a high LDL. So remember, cholesterol, bad cholesterol, LDLs high, good cholesterol low, triglycerides high. Usually it's a blood sugar imbalance. And so first thing you want to do is start checking your glucose, checking to see why your blood sugar is going high, if it's crashing down. What you need to do to make those changes is what you're putting in your mouth. Cholesterol high is usually not eggs, it's not bacon, it's not too many avocados, things like that. It's usually from those sugars going high, the glucose going high. So first thing you've got to look at is looking for the glucose levels and seeing what's going on. Sometimes if somebody's thyroid has gone really out of balance and their thyroid's really low, their thyroid numbers, that could also be affecting that cholesterol. So start with what you're putting in your mouth. And Cami, quantum energetic work. Yes, I have seen some quantum energetic work. Deanne, hello there. Kai, you are welcome. And let's see what else we have. Kate, North Carolina. Yes, that is definitely on our radar. As soon as we get the Knoxville location up, then we'll be expanding in that southeast region, South Carolina, North Carolina. We will be going through there. On that note, if any of you guys have a local doctor, anybody that you know that would be good at this type of work, pass their information along to us or get our information to them. We are looking to partner up with some great offices around the country and bring this to the masses. And yes, we are waiting for you in Rhode Island and Southeast Mass. Hey, Lynn, my in-laws are in Bristol, so they would definitely appreciate an office just down the road there. And we love going out to Newport and all the fun places in Rhode Island. Let's see what else. How can one reverse or completely heal Crohn's disease? Where do you start? Well, think about this. Crohn's disease is an autoimmune disease, right? So the body is attacking its own digestive lining. We've got, yes, the symptoms of whether that's diarrhea or gas, bloating, gurgling, pain, whatever it is in the digestive tract. But Crohn's, ulcerative colitis, we look at those as autoimmune conditions, and that immune system is revved up. So one, yes, you've got to take we've got immunoglobulins and we've got different probiotics and kill off bad stuff and bring in good stuff and all these different things. But ultimately, you've got to stop damaging the tissue in the first place. So you've got to calm down that autoimmune inflammatory cascade. And that's for any of you guys out there that are dealing with autoimmune. This is the same thought process. Is, you know, we draw these lines off of autoimmune, and you know, we've got to calm down the stress in the adrenals. We've got to stabilize that blood sugar. Every time the blood sugar spikes up too high or crashes down too low, you rev up that immune response and you destroy more tissue. So we've got to get that blood sugar stabilized. Your vitamin D needs to be up at 80. And Kendra, have you checked your vitamin D level lately? It needs to be at 80. If it's not there, you've got to take some vitamin D, you've got to get some sun, tanning bed, whatever you can do to get that vitamin D up. You've got to look at any infections in the body. We see all the time people are dealing with chronic bacterial or viral infections, and that's driving that autoimmune. We do the brain map so that we can go through and say, you know, is somebody in a chronic fight or flight state? And if they are, that's going to be revving up that autoimmune all the time. So thanks for jumping on, Kendra. You've got to start with calming down all these systems, calming down. Again, we're going to go back to blood sugar. This is where we start with all of our patients, especially with autoimmune. You've got to get that blood sugar as stabilized as possible. That's why we use continuous glucose monitors with every new patient that we start care with. Cynthia, great to see you. And Carol, great to see you again. Long time listener here. Thank you, Carol. What can you do for fluid retention in feet and ankles? Limit caffeine, salt, drink lots of water, elevating legs. One of the questions, Carol, is what's your blood pressure doing? Usually what I see when we have swelling and fluid retention, I'm going to go back to the blood sugar again. Almost everybody that has high blood pressure that is holding on to fluid, if we get that blood sugar stabilized, we start seeing these changes. Probably some liver enzyme. Check your AST, ALT, and GGT. You have to check that GGT as well. Most doctors do not do that. Those are your three main liver enzymes. So check all of those. A lot of blood has to pump through the liver, and so if it's not, then that blood pressure can go up. We can hold fluid, and you may need to do some liver support, some type of a liver cleanse in there as well. And Angie, can a sluggish liver cause overall cholesterol to be high? Great, we were just talking about liver. Absolutely. So that sluggish liver, so think about it this way. A lot of people think about the liver as a filter, that we live on a septic tank, so we have the little screen. Give me a thumbs up if anybody else lives out in the country on a septic tank. So we've got a screen in the sink, and food gets in there, food scraps that we don't want to get into the septic tank, so we take it out, go dump it in the trash, put it in there again, and there's some thumbs up, some of you country folk out there. And so that is not what the liver does. The liver does not screen out toxins. So that's why you should be able to eat cod liver. You should be able to eat different livers. A bunch of thumbs, good. So we've got a liver is not a filter like that. The liver changes the chemical structure. It changes it via the phase 1 and phase 2 detoxification, and makes it so that it can be eliminated out. Meaning we need to be able to bundle it up, pass it through the digestive tract, and then have a bowel movement, and you excrete that toxin. So what happens with the liver is that it's going to actually have inability to detox things out of the body. So is it sluggish? Well, it can be a slower processing of toxins. If the liver is stressed, if those enzymes are high, we can definitely see that cholesterol go up. So one of the big things, yes, a lot of people answered that post we had this morning, and they said, oh, it's from sugar and blood sugar and carbs and all that. And yes, that's part of it. And yet, the liver, if the liver gets stressed and isn't working, that's where we produce that cholesterol. So if the liver is stressed, and every patient that we work on, if there's any sign of liver issues, liver stress, we will go through and cleanse and support that liver. Really need a one-on-one visit, but I'm in Michigan. Recommend anyone in Southeast Michigan. Unfortunately, I don't know anybody in that area. We do work with patients all over the country. So if you need to talk, we can do that. Just send us a direct message there. And all right. Laura Miller, worth the flight to see Doc. Oh, that's sweet. Thank you. And Michelle, that's my wife there. Is it your birthday? It might be my birthday. How do you address the Dickrum's disease? So here's what we're looking at. No matter what somebody comes in with, whether it's some obscure thing or something that, everybody's got, like Hashimoto's, any of these things, you know what? We've got to come in from the same perspective. People come in with MS, rheumatoid arthritis. I've got a lady that had autoimmune condition. I can't remember the name of it. It's so obscure. And she was in a wheelchair and her double vision past 6 feet and all these things. Within 3 months, she had gotten rid of her wheelchair. She was walking again. She drove down from Wyoming and was able to see to be able to do her follow-up blood work. How did we do that? Well, we went through and fixed which systems were out of balance, and that's the fun part about doing this process. You take out the bad stuff, do more of the good stuff, and the body starts making some dramatic changes. So that's what we look at with any disease. There's no magic anything. Just started working this week with a lady that's got stage 4 breast cancer. I'm not treating her cancer. We're going to support her body. Hopefully, she doesn't get too beat down by the chemo, but we're going to support her body to fight as much as it possibly can with this cancer. And guess what? She was on the diabetic side, and she's skinny as all get out, and her glucose is out of balance, and her metabolism, and all these different things. And that's even cancer is a metabolic disorder. It's not a genetic disorder. Her estrogen was through the roof. What are we going to do for that? Well, we've got to make sure she's eliminating it. All these things. So it doesn't matter what the disease is. We've still got to come from that underlying imbalance. Colleen, do you use essential oils? Yes, we use essential oils in our household all the time. Are they the be all and end all? Are they going to cure different conditions and reverse diabetes, all that? No. But is it a nice adjunct to a lot of different things? Absolutely. So definitely those essential oils can be helpful. And so good. Mary, sister goes to a doctor in Winston-Salem. Nice. My ferritin was at 6. At 6 months ago, I've had increased debilitating pain and decreased energy. Kai, here's what you've got to figure out is why is your ferritin low in the first place? Sure, you can take iron, you can take all these things, molasses, whatever, that may bring up your ferritin. For all of you guys out there, ferritin is stored iron. Remember the periodic table, Fe, ferritin is stored iron. So 6 months at 6 months ago. So we like ferritin 40 to 150 in men, 40 to 125 in women. Ferritin is, if I could only run one marker, it would be ferritin. And that's because if it's high, that's going to be inflammation, liver, C-reactive protein inflammation is high, the blood sugar, insulin resistance, all these different things if it's high. If it's low, it's usually either you're losing lots of blood, so maybe that's that endometriosis that you're losing blood in there. Maybe you're not absorbing as well as you should. Maybe you've got some leaky gut, irritation in the gut lining. So that's the first place that we have to go is figure out why you're low iron in the first place. And if it's endometriosis and you're just losing lots of blood, bleeding for 12 days a month, heavy, whatever it is, we've got to figure out why that's there. If that's not too bad, then it's probably in that digestive tract. And so if someone's ferritin is low, we go through and we heal up the gut lining and we do as much as we possibly can to get that built up. So, is it safe to drink electrolytes daily? For example, coconut water. The concern with coconut water is you want to make sure that it's not making that blood sugar go up. So check your blood sugar after you have that coconut water, even 15 to 60 minutes, anywhere in there. It might spike up pretty darn high. But yeah, here's what you do, Ashley. If you want the cheapest and most variety of electrolytes, you get the, and we'll put a link down below, Brittany, for the Grain and Salt Society, the Celtic sea salt, and it is the best salt out there. It's the best electrolyte out there. They've assayed sea salts, and it always comes back like 3 times the number of electrolytes and minerals as other sea salts. So you may have a favorite sea salt out there, and yet it doesn't have the electrolyte value of the Celtic sea salt there. And with this one, there's over 80 different electrolytes and minerals in it. So taking even at least an extra teaspoon per day is going to be great. Most people need those extra electrolytes, especially if they're drinking lots of water. So a lot of people, they'll be drinking a gallon of water a day and they're flushing out electrolytes, and they need to add some back in. So yes, add some of those electrolytes. The cheapest and best is that. Kristen, you are so welcome. And Tanya, good to see you. And let's see what other questions we have here. Can you heal hypothyroid? Great question, Debbie. Well, again, what do we get back to? Why? What is hypothyroid from? And everybody may have a different reason, but it's like 80% of women, if they're hypothyroid, they have Hashimoto's. So give me a thumbs up. Any of you guys have Hashimoto's out there, or we can do a thumbs down, unfortunately. So Hashimoto's, 80% of the people with low thyroid, it's autoimmune. But guess what? How many types of Hashimoto's are there? We've talked about this before on our page here. There's two types of Hashimoto's, one to the thyroid itself and the other to the bus. So you not only have to know if it's Hashimoto's, you have to know what type, and then at that point you have to calm down that immune inflammatory cascade that is affecting that thyroid, that's attacking the thyroid. If it's not Hashimoto's, then you got to figure out what's going on. Maybe you're under converting T4 to T3. Yeah, unfortunately, a bunch of thumbs up coming there, guys. I know a lot of you are dealing with Hashimoto's out there. So there's underconversion, T4 to T3. There's poor thyroid function coming from iodine deficiency and selenium, some of these things. So you've got to figure out the why. So yes, you can get your thyroid functioning way, way better, but you've got to figure out that underlying why. Debbie, do you have Hashimoto's? Let's see what else we've got here. What do you recommend for a quick immune boost? Tanya, great having you on here. So what we do with our patients is if somebody's coming down with a cold, a flu, anything at all, we will give them 50,000 IU a day for 3 days of vitamin D. Obviously that's a high dose, and if you're working with a practitioner, health practitioner of some type, you definitely want to double check with them, but that's what we do. We'll do a quick boost of vitamin D, and that is going to stimulate that immune system, get it going well. Some people will do that with vitamin A as well. You can do some oil of oregano, can be really good for that immune system. Like we posted below, if you use Young Living essential oils, you can even put the Thieves drops into a gel cap and swallow that, and that will help stimulate that immune system as well. One of my personal favorites is the sauna. So if you have access to a sauna, get in there and just toast your body. We'll post a link down below as well. Brittany, if you can do that, it's a great little portable one where the head sticks out. You can get up to 140 degrees and feel really, really good. Michelle, great to see you. Once you feel like we've got the autoimmune calmed down, is it more than likely that you need to still, and it cut out there, still keep doing everything that you're doing? So, Michelle, what we look at is if you do what you've always done, you're going to get what you've always got. So if somebody goes back, I was just talking to a lady yesterday, and she's like, I can handle a little bit of cheese now. I can handle a little bit of grain, or I had gluten and didn't have a big reaction. But her knee, she's got lupus, and her knee really swells up. And I'm like, it's like this. If you go back and do exactly what you did before you came in as a patient, and we reverse that lupus, and now your body is doing great, and your knee doesn't hurt, and you can hike and run and bike and all these things, if you go back and do the same thing again, guaranteed 100% you will go back to that old pattern and have those same symptoms again. So, we are never free. Unfortunately, that doesn't just like, okay, good, now I can start eating the Starbucks rolls and mocha latte, cappuccino, whatever it is, and drinking 1,200 calories at a time and spiking blood sugar and all these things. You can't just go back and go down that road again. And most people don't want to, because you're feeling so good, and if you go and eat something like that, it's not going to be feeling very good in your digestive tract or inflammation or whatever it is. So you've got to keep it calmed down and don't go back to what you've done before. Let's see what else we've got. What glucose monitor do you recommend? So simple. We've done finger prick glucose monitoring for years. So on Brittany, you can post a link to that one that we use on Amazon. So you can just get your simple finger prick one. And it's like $40 or whatever it is, and you check that glucose throughout the day. We use Dexcom 6 with our patients for the continuous glucose monitors, and that's prescription only, and so that has to be with our patients on that one, so I can't get you a link to that one. Hey Michelle, happy birthday, thank you so much. And Laura, thank you. And kidney stones, what is the cause and what can you do to prevent? So what we look at with kidney stones, it's usually kind of like uric acid, which is gout. It's kind of like anything where the body's just out of balance with the inflammation, and it's holding on to different types of electrolytes, and the kidneys aren't processing appropriately. So first thing we do is to start with the basics, and whatever shows up, if the liver's off, if the gut's off, if the blood sugar's off, if we have infections, whatever it is, we have to take a step back and start there. But yes, some people genetically make a few more kidney stones, but absolutely. Kim, thank you, and thanks, Carol. Kristen, thank you. Oh, Gina, that is sweet. Are you a September birthday as well? Can't wait to see you in October. Jane, great to see you coming up too. That's going to be wonderful. What other questions? Oh, same birthday as your granddaughter. That's great. Let's see. Go ahead and, what do you do for relief of chronic impaction? So again, we got to figure out why is it going on. One of the main things, check for a gag reflex. So you take that popsicle stick, stick it back in there, the back third of the tongue. You should have some type of a gag reflex, eyes water, something like that. If not, very good chance that the vagus nerve is not working. Vagal nerve tone is going to be what's stimulating the gag reflex, but it's also stimulating your peristalsis. Peristalsis is that wave-like contraction pushing food through as it turns into fecal matter, and then it's excreted out. But if it's not going like that, then it's going to back up and you're going to have a lot of issues there. So increase your water intake dramatically, and that can be helpful, but you definitely want to add those electrolytes in, like we've got the link to down below there. And then you want to also, short term, you can increase your magnesium until you go. But remember, ABP, always be pooping. You gotta go every single day, Michelle. And let's see. Hey, Eric, great to see you. Long-time listener there. And yep. So DD, make sure you have K2 with the D3. Yes, we've added K2 to our D3 over the years. We haven't seen any negative side effects from just doing vitamin D in the past or with K2 and any extra value to it, but the research is showing that there can be some value in adding that K2. So yes, we'll usually do that. K2, it's another type of fat-soluble vitamin there. Michelle York, can I try eggs? Yes, you could try eggs. Look for any reactions, inflammation, swelling, brain fog. Do it for 2 or 3 days, see how the body does, and just pay attention to your body. Michelle's been working with us for quite a few years now, and she knows her body very, very well. But yes, go ahead and try eggs and see what that does. And yep, there's the portable sauna link. Those are great. We use those all the time. And any other questions? Do you treat kiddos? Ours has a hard time staying asleep. Absolutely. So one of the big things that we look at is a brain map. A brain map is a quantitative EEG. It's like a swim cap you put on the head, kind of like an EKG of the heart. And there's sensors where we detect electrical activity. How much electrical activity is in different parts of the body. And what we see is that I just had a lady, she had brought her 5 kids in for brain maps, and they're using a home unit. And those kiddos, I think 4 out of the 5, their sleep wave was really, really high. And so not a single one of them is going to get a good restorative sleep or not going to stay asleep. They're just not going to wake up refreshed in there. So one of the best things you can do is get a brain map and look for neurofeedback, and that's going to make dramatic changes in that sleep cycle. Dr. Josh Axe with Ancient Nutrition. He's down at he lives in Nashville. He's going to our Nashville office specifically for sleep for neurofeedback. So it is a great tool. What causes the vasovagal? Usually that vagus nerve just not being quite as good as it should be. So gag, gargle, hum are the 3 things that you can do to stimulate your vagus nerve at home. So every time you drink a glass of water, gargle, gag yourself when you brush your teeth, and then hum in the shower, hum in the car, as much as you can on those. But vagus nerve, gag, gargle, hum. How do you fix the vagus nerve? Gag, gargle, hum. If you're already doing those other things, yes, so try those. And yes, D3, we want that. What is your go-to treatment for fibromyalgia? We talked about this earlier. Amy, if you missed that one, pop this video back on when we're done. And fibromyalgia, remember, it's kind of a catch-all phrase. And a patient, I just talked to her on Tuesday, and she's down 27 pounds. Fibromyalgia pain is totally gone. They live in an RV, they're traveling all over and hiking and doing all kinds of fun stuff, and she doesn't have any more fibromyalgia pain. We did not do the fibromyalgia protocol. We went through and did the fix what you find protocol, and whatever systems were out of balance, that's what we have been working on. So fibromyalgia, just like everything else, you have to take a step back and go from there. Michelle, great to see you. Yes, you've done an amazing job. Gallbladder, what causes the most problems to your gallbladder? I had been having flank pain and I've always had it. So, and this is Pam, great to have you on. So gallbladder, so common. It's like, every other person has had a gallbladder issue, if not had their gallbladder taken out. One interesting part of it, in traditional Chinese medicine, the gallbladder meridian is most active between 11 and 1 at night. And so a lot of people, if they are doing overnight shifts, if they're staying up too late, if they're not sleeping between 11 and 1, they are not purging that gallbladder, not repairing it, rebuilding it, things like that. So one of the first things to do is start getting to bed earlier for people with gallbladder. Number 2 is we've got to make sure that we're breaking our food down as well as we can, especially in the stomach. If somebody doesn't have enough stomach acid, by the time it gets down into the digestive tract, the small intestine, they may not be breaking down as well as they should, and that gallbladder is going to have a harder problem. But ultimately, let's get the diet figured out, get the blood sugar stabilized, work on that liver, get the inflammatory foods out, everything we possibly can there. So gallbladder is a huge part of it. Let's see, anything else here? Michelle, you've got a gag reflex, good job. And I'm gonna have to jump here in a second. My mom had her gallbladder out years ago, and after eating breakfast or lunch, 90% of the time she had diarrhea. Yep, so Suzette, send me a message, email me over, and I'll send you a link on FullScript what you can take. But it's the bile salts can be really helpful. If you don't have your gallbladder anymore and you're not digesting very well, look for bile salts, and those are going to be helpful. You can take that with a meal, especially if there's fat in it, but I can get you a link for that one as well. All right, guys. Thanks so much. I've got to go. People to help, people to heal. Michelle, thanks for the birthday message there. Lots of fun stuff in this world. We have to keep our body strong. We have to keep our body vibrant so that we can be the best we can be. We can give more. We can do more. We can be more. You've got so much potential inside of you, and that's this God-given potential for us to just be the best we can be. The best parent, the best sibling, the best son or daughter or spouse or whatever it is, you have so much to give this world. Take it by the hand, go with everything you've got, and it starts with your health. Because for those of you on here that do not have health or have not had your health in your past, you know that life is almost pointless without it. It takes everything you possibly can to think about it, put into it, and be conscious of what you're doing to your body every single day. We're here to help. Love having you guys on every Thursday, live Q&A, 8:30 Mountain Standard Time. Be here and bring your questions, and we love having you. If you've got any other questions, or if you're watching this later, pop questions down below, and we will be answering down the road as well. Make it a great day, everybody.